Welcome back to Understanding Human Anatomy and our discussion of the arteries of the upper extremity. In the last video, we talked about the subclavian artery. I want to continue on the path out to the distal region of the upper extremity by talking about the axillary artery next. The axillary artery. Let me sketch in the axillary artery, beginning over here. And the artery comes around, and as it exits the axilla, it's running vertically. Finish off the drawing here, and as we did last time, we'll color it in to make it much more easy to see. Now, the first branch of the axillary artery that we're going to talk about comes off the superior side here, and this is the thoracoacromial artery. Let me put it in over on the diagram. It shows the entire pathway. The thoracoacromial artery. The thoracoacromial artery has pectoral branch that goes to the pectoralis major. It has an acromial branch that goes up to the acromion. So it supplies both the pec major and the acromial area. The next branch comes off the inferior surface, and it runs inferiorly on the thoracic wall. This artery is called the lateral thoracic artery. Let me put it in over here. And we'll add a label. The lateral thoracic artery and it accompanies the long thoracic nerve down the lateral chest wall on the superficial surface of serratus anterior, and is the primary blood supply for serratus anterior. After these two arteries, we're going to move over to where the artery curves much more, is making its bend downward. And we're going to look at two arteries that come off very close to one another. One comes off and passes posterior around the the surgical neck of the humerus. The other one comes off just a short distance away, and it wraps around anteriorly around the surgical neck of the humerus. And when these two arteries meet up, they anastomose. They run one into the other one. And I'm going to show that just by using this diamond-shaped connection here. And over on the small, we have one going this way, one coming this way. And the interconnection. These two arteries are the posterior and anterior circumflex humeral. So let me get some labels in here. The first one is the posterior circumflex humeral. Showing here, and the other one down here is the anterior circumflex humeral. And the term circumflex means to surround. So these two arteries together surround the surgical neck of the humerus. The anterior circumflex humeral passes on the anterior side. The posterior circumflex humeral passes on the posterior side. And the posterior circumflex humeral accompanies the axillary nerve around the posterior side of the humerus. They both pass through a space called the quadrangular space, and the axillary nerve supplying deltoid, posterior circumflex humeral, will also be supplying deltoid, as is the anterior circumflex, among other things. Now, I need to draw in some couple of branches of the posterior circumflex humeral. It has a branch that goes and ascends up towards the acromion, and this is just called the ascending branch. The ascending branch. And then there is a descending branch coming from the posterior circumflex humeral and running posteriorly. And it would keep descending. And this descending branch will connect with arteries ascending, particularly a branch from the deep brachial artery or profunda brachii. So this one is the descending branch. Let me draw in the ascending branch over here on the smaller diagram and the descending branch. There's one more artery that branches off of the axillary, and that is the subscapular artery, which I'm drawing in here. And draw it in over here as well. Let me put the label up. The subscapular artery, as you might guess from its name, supplies the subscapularis. It goes to the anterior side of the scapula and then sends a branch around to the posterior side to help supply teres major, teres minor, and infraspinatus. So this is subscapular. Here. Then, as I said previously, the axillary artery ends as it crosses the inferior border of teres major and becomes the brachial artery. I've indicated the inferior border of teres major over here with the black line to show the separation between axillary and brachial arteries. So next we'll look at the brachial artery. In this slide we'll look at the brachial artery and its branches. So let me begin by sketching in the brachial artery. And the brachial artery begins superiorly, runs down the length of the humerus. As it gets to the cubital fossa, it divides into two. Like so. And again, I'll use a shortcut to color it in. There's the brachial artery and its terminal branching into two arteries, the radial and ulnar arteries. And again, when you have an artery end by dividing into two like that, it is often referred to as a bifurcation. Now, the first branch of the brachial artery is a very important one. And it branches off the medial side of the artery. And then loops behind the artery to get to the lateral side. And as it goes behind the artery, it passes along the posterior border of the humerus. And this artery ends by dividing into two. As well. So it ends in a terminal bifurcation. Now this artery is profunda brachii, or the deep brachial artery. Profunda brachii, or the deep brachial artery. And this is the artery that supplies the posterior compartment of the arm. And it is a very large artery and significant artery. Let me draw it in on the other diagram. Starts on the medial side, wraps around posteriorly to get to the lateral side, and then ends by dividing into two. Profunda brachii. Now, profunda brachii has some branches, and one is an ascending or deltoid branch, the deltoid branch or ascending branch of profunda, and then it ends in terminal branches, one being the radial, collateral, and collateral just means parallel to. So this is going to be parallel to the radial artery. And the other one is the medial collateral. The medial collateral, and since I don't have room to put that name right next to the artery, I'll put a line over to it. And let me draw in the deltoid branch over here. Now, there are two more branches of the brachial artery before its terminal bifurcation. One is the superior ulnar collateral. The other one is the inferior ulnar collateral. Let me put them in over here. A superior ulnar collateral and an inferior ulnar collateral. So this one that originates more superiorly or closer to the head is the superior ulnar collateral artery. The superior ulnar collateral artery. The one that originates closer to the bifurcation is the inferior ulnar collateral. Now, the brachial artery gives off many branches to muscles which are not individually named, but it supplies the muscles of the anterior compartment of the arm. So the artery for the anterior compartment of the arm is the brachial artery. The artery for the posterior compartment is profunda brachii. Now, I said that the brachial artery divides into two. One artery on the lateral side and one artery on the medial side. The artery on the lateral side is the radial artery, and the artery on the medial side is the ulnar artery. So the brachial artery terminates by dividing into radial and ulnar arteries. We'll stop at this point with this video and continue in the next video with description of the radial and ulnar arteries and the arteries of the hand. Thank you for your attention.